right. We will be talking to Representative Morgan Griffith towards the bottom of the hour from Virginia, chairman of the House Energy and Commerce Subcommittee and Oversight and Investigations. Recently had hearings examining this COVID response by the federal government. He is focusing on propaganda and health policy. It'll be very interesting to hear his findings. But first, we're going to bring Dr. Simone Gold around. She's a board-certified ER doctor, 20 years of experience. She's also a Stanford-trained attorney. Selective Prosecution is the book, the legalization of, I can't read the name of that. Help me when we get back to
American Fascism. The title's called Selective Persecution.
The legalization of American fascism. I love that. She established Gold Care, a platform providing medical freedom and a doctor-patient relationship. We have got so much to talk about with Dr. Gold. She was there at the Americas. She established the America's Frontline Doctors, and she was at the center of many controversies that so many of us were, in retrospect, because she got it right. Be right with her after this.
Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want help stop it, I can help. I got a lot to say. I got a lot more to say.
I'm excited to bring you a new product, a new supplement, Fatty. I take it, I make Susan take it, my whole family takes it. This comes out of, believe it or not, dolphin research. The Navy maintains a fleet of dolphins, and a brilliant veterinarian recognized that these dolphins sometimes developed a syndrome identical to our Alzheimer's disease. Those dolphins were deficient in a particular fatty acid. She replaced the fatty acid, and they didn't get the Alzheimer's. Humans have the same issue. And we are more deficient in this particular fatty acid than ever before. And a simple replacement of this fatty acid called C15 will help us prevent these syndromes. It's published in a recent journal called Metabolites. It's a new nutritional C15, pentadecanoic acid it's called. The deficiency that we are developing for C15 creates something called the cellular fragility syndrome. This is the first nutritional deficiency syndrome to be discovered in 75 years and may be affecting us in many ways, and as many as 1 in 3 of us. This is an important breakthrough. Take advantage of it. Go to fatty15.com/Dr. Drew to receive 15% off a 90-day starter kit subscription, or use code Dr. Drew at checkout for that 15% off, or just go to our website, drdrew.com/fatty15. All right, you can follow Dr. Simone Gold on X, Dr. Simone, Simone Gold, just like the element. TheGoldReport.substack.com. And of course, the book, let's put it up there again, Selective Persecution. I think I said prosecution. The Legalization of American Fascism, which I am absolutely fascinated to talk more with her about. As I said, she's worked in the ER for 20 years, board certified in that discipline, as well as a JD trained by Stanford University. Founding the America's Frontline Doctors, she was in the middle of a 2020 press conference addressing COVID-19. She ultimately established Gold Care, platform providing medical freedom in the doctor-patient relationship. There she is in front of, I think it was the Supreme Court at that time, talking about rational responses to the COVID-19 so-called pandemic. Dr. Gold, welcome to the program.
Thank you so much, Dr. Drew.
So I've got a million questions, and I'm excited to talk to you. I think let's start with the book and maybe define what your goals were in that book and what you mean by American fascism. And let me tell you why I'm asking it that way. Because one of the most astonishing features of this pandemic was that the whole world followed our ridiculousness, the whole world. And maybe not Africa, where they got it right and things were much, much better there. But essentially the Western world followed what we did. So have at it.
Yes, so I think I saw it a little bit earlier than my physician peers because I was open-minded to it and also because of my legal training. And the reason I titled my book Selective Persecution, which is a play on prosecution based on my ER training, the legalization of American fascism is people have to know that fascism doesn't look the same everywhere you are. From the citizen's perspective, it is very tyrannical. It's almost enslavement no matter where you are, but it's a little bit different. It's not going to look like it does in China or in the USSR. It's sort of an American flavor to the fascism, to the tyranny. So this happens to be my personal story of everything I went through, from being a COVID policy whistleblower and watching the alarming infringement of our constitutional freedoms based on ridiculous public health policies, absolutely absurd and illegal, to becoming targeted by the government in J6 in my imprisonment. And I saw how illegal the FBI was acting, how illegal the DOJ was acting, how the judges had did things that were so inconsistent with proper judicial temperament. So every chapter walks people through what I directly experienced. There's a lot of receipts in the book. There's tons of references. It's very well, I don't want anyone to say that, I'm taking any liberties with the truth. I give specific examples why I'm pretty alarmed at the infrastructure of tyranny that we really do have in our nation. And thank God we have a change in administration, but that infrastructure for tyranny is still there. When you read how the FBI came and, broke down my door, and you read how I was sent to a maximum security prison, these things couldn't have happened if we didn't have, really an infrastructure for tyranny that's already here. So it's very eye-opening, but it reads rather like a John Grisham novel, quite frankly. You can't believe it's real.
So you need to make it into a movie so people, or a documentary, or both. I'm guessing that's coming.
I think, a lot of people think it should be a movie. It's kind of an Aaron Brockovich, David Goliath thing. I went up against the federal government after me hard. I was attacked by the California Medical Board. I was attacked by the New York Bar. I was attacked by Congress. And a very interesting chapter relates how the federal government tried to plant narcotics on me, which would have been the best way to take me down. And I have all the receipts. It's quite something.
And so what are your remedies for all this? And so you have your personal remedies, and then what do we as a citizenship need to do?
I wrote the book so that people can be armed with information. I don't want people to be depressed. We don't yet live in China. Like, there are resources, and one of them is just starting with being awake to the situations around us. One of my pleas in the book is that the ordinary American citizen doesn't comply with things when they seem bizarre. It's heart-wrenching that the FBI officers who were breaking down my door, once they got there, they clearly realized this was over the top, right? So I want an officer who finds himself in that situation to pause and to say, is this right? Like, I want people to think in the moment. This was on the heels of my noticing during COVID that doctors and nurses were not doing the right thing. They were just following orders. And so part of this is just kind of a wake-up call so that you in your own life, no matter what job you have or neighborhood you live in, when you see a tyrannical kind of infrastructure taking hold, is to push back on that. So we do have recourses.
Yeah, I mean, it seems easy to say that. I mean, it was by the time everyone was caught up in a hysteria, though, the populace played the role of enforcer, much the way they did in 1939 in Germany. And so that's the part that's really scary.
We're on the same page. I talk about that a lot. I'm very sensitive to it. My father was a Holocaust survivor, so I grew up knowing these stories, how quickly a society can absolutely turn against a disfavored minority group, in this case, political conservatives. I'm well aware of that. There's a lot of practical advice in the book. One of the things I want to share with people is this fear that humans have of being, having a reputation damaged. It's intrinsic really to the survival of the human species. I understand it. But it's next level in our time. It's instant worldwide communication that can bring down a person's reputation. We call it cancel culture, and it is very, very strong. But I'm telling you that there are worse things than having your reputation smeared. You have to do what you know is right in your soul, or else you start self-censoring yourself, and your soul starts dying. And more profound people than myself have said it more eloquently. But that's my advice to you. We live in a time of cancel culture, but it's not the worst thing in the world to look that beast in the eye and still do what you know is right.
Well, it's hard to keep your compass due north when all the craziness is around. I knew immediately something was wrong, but I missed the amount of infectivity. I missed how sort of brutal COVID was going to be in certain populations. It was brutal. It was a tough illness. But I knew that the reaction was wrong. I knew that the risk reward was not being contemplated by anybody.
There were specific things I knew as a physician that became clear early that were a lie. For example, if the power brokers had simply said hydroxychloroquine didn't work for SARS-2, I might have gone more along. But instead, they said it wasn't safe. Now, this was a drug at the time was FDA for 65 years, right? And then they mocked ivermectin when it literally won the Nobel Prize for medicine. So they went too far with their lies. And when you see that in your own life, when you see people saying things that you know are false, you please do not self-censor. That's really what drove this, was a lot of people fear over cancel culture.
Yeah. So when that was all going on, I do this, the internal medicine, we have this thing called the MKSAP, which is sort of a board review. It's a very comprehensive board review. We do I don't know if ER has something like that. Oh, why do you put Gelman amnesia up? I guess that's part of.
She was literally just referring to Gelman amnesia, which a lot of people experience.
You know well. Yeah. It's you think you are wrong, even though you know when the press writes about something that you know well, they are always wrong. Guess what? They're always wrong. Period. But what was I just talking about? Damn it.
The MSKP.
Oh, the MKSAP. Thank you. And just for your future edification, when you bring this particular topic up, hydroxychloroquine and canceling people who want to use a simple medication that's over the counter most of the world, is that in the MKSAP, in the rheumatology section, in 2019, I was doing it, and I was like, oh, look at this. There was a question about maintaining your lupus patients on hydroxychloroquine during pregnancy. And yes, you are supposed to continue I don't know of any medication, including Tylenol, that's recommended, like purely, it's recommended to continue the hydroxychloroquine for your lupus patients during pregnancy, period, full stop. And I don't know any other medication that's like that.
Wait, you got the answer right?
Yeah. So the CDC on their website all through most of COVID, and then they took it down for 2 years, and I think it's back, said it's safe during infancy, breastfeeding, elderly, and pregnancy, right? Yeah. And the American Association of Rheumatology said the same thing.
Yeah, and it was in our board review, and they took it out in a subsequent review that I'm doing now, which is every 4 years they do it, or is it 2 years? Whatever it is, I try to always do it. But now and at the CDC also had up that everybody who came in this country as a refugee from the majority of countries out there had to take ivermectin for a couple of weeks, right?
Correct. Yes, you are
dangerous medicines.
Knowledgeable. It's exactly correct. People coming from the Middle Eastern parts of the world had to take ivermectin coming to this nation. At the same time, the FDA was mocking it as horse paste. It was outrageous lies. So
thankfully, in my career, I'd used both medication. Hydroxychloroquine I'd used for years, and by the handful. But even ivermectin, I used to work at a county hospital, and we would see all kinds of helminths and all kinds of crazy worm infections. And so, ivermectin changed everything. We had the opportunity to use it. We did. It never hurt anything. I took it myself during COVID. I don't think it worked. I was really sick, but it didn't hurt me.
Right. So they took the lie too far where they said that it was not safe. And so then that kind of woke people up. But we're left with this huge problem, right, Dr. Drew, that people don't trust physicians. And I'm sorry, I agree with that. I think most physicians should not be trusted. I think we saw that the physician didn't put the patient's interest first. We saw that a lot. And it is also why I launched Gold Care, which is national telemedicine, where we prioritize the doctor-patient relationship. The doctors are only paid for their time. They're not paid by Big Pharma. There's no other route. It's just really like modern old-fashioned medicine, because it was very upsetting to me. I'm a daughter of a doctor. I'm a doctor for a long time, and I couldn't believe how doctors just abandoned their patients. They didn't care.
What is your theory about what happened to us? Is it that we were mostly employees, which was new news to me? I didn't realize that. And there was centralization of decision-making, and people were in a hysteria and scared to do anything where they might use their judgment or put the patient care ahead of everything else like they're supposed to?
Yeah, we're very much on the same page. I think there's a few different things that have coalesced, but the easiest one to explain is in my dad's day, 85% of doctors were small business owners, and their clients, their employer was the patient. So the interest matched. The patient's interest and the doctor's interest matched. Flip to my time in the last 5 years, about 15% of doctors are self-employed. And those, the 85% are answering to their corporate employer. I will tell you, in my case, I was fired and threatened to be fired by the hospitals for speaking out. and California Medical Board and other states sent letters to doctors that you could lose your license if you prescribed hydroxychloroquine. So there are powerful interests that are allied against the doctor-patient relationship. But there's ways around it like that. Gold Care is not the only one. You need to find a doctor and just work with that doctor outside of the insurance model or the government model.
Yeah, I agree. Patients have to take control of their health care. And I want to find every way to do that. I've sort of abandoned my protection of the doctor-patient relationship because it's been so frustrating. You're a little, I spent years as a Medicare provider and insurance, you can't imagine the struggles, and it just was so pathetic and so awful that I get the feeling now that we just got to empower the patients to take care of their care.
Dr. Drew, we're on exactly the same page. So again, my dad was a doctor. My mom used to do his billing. I know exactly what the fights were with Medicare. I was protected a little from that. As an ER doctor, right? We had administration do it. But I know, you really can't win against the behemoth of legacy healthcare. We do these, we do monthly town halls where we just educate people because we want people to have the truth. So next month we're doing measles. We do all talks on, what is the truth on repurposed medicines and cancer care. The truth about vaccines. This is what we bring. We had a town hall on Ozempic, the pros, the cons, and informed consent, bird flu, same thing. So we just want to empower people. I'm happy if people need doctors less often, quite frankly. I think we've medicalized a lot of things that maybe shouldn't be medicalized. Maybe you need a counselor
I agree.
or just a advisor. Yeah.
Yep, completely agree. And or just educate yourself. And, these are things that people understand now. They can make good decisions, and then we are supportive care. But I want to go back to my original question, though, which is, I was listening to French radio this morning, which I do all the time, and they were replaying clips of the progression of what happened in France. From masks they had the same exact progression. Masks don't work, or if they do work, only the N95s. And now everybody's out. No, it just, not outdoors. Yes, outdoors. They just rolled down the hill just like we did. And I thought, wow, how did the whole world do that? How is that possible? And was it organized in some way? Is there some, you said there's been a totalitarianism at foot here. How did it get over there?
No. I can answer you a little bit more detailed. There's a whole one chapter in my book goes over kind of the public health politics of this that permitted all of this to sweep the world at the same time. There were huge financial interests. I'm going to share a tidbit with you, Dr. Drew. It's going to blow your mind. Everybody thought that the hatred on hydroxychloroquine was when Trump endorsed it. I think it was March 17, 2020. But here's something that's going to blow your mind. Hydroxychloroquine is over the counter in a lot of the world, in the third world, and also in nations where people travel to Africa, for example, to go on holiday. One of those nations is France. And I learned this from Dr. Didier Raoult's staff. So France quietly pulls hydroxychloroquine's over-the-counter status, not March 17th, March 18th, when it blew up. They actually pulled their status of hydroxychloroquine being over-the-counter 2 months earlier, January 13th. In other words, it was kind of planned to attack hydroxychloroquine because, as you know, the shots could not be rolled out quickly if there was an alternative treatment. So if we had to eliminate the possibility, but that's very damning, that piece of information. France knew, and it was kind of planned, like the hatred. So yeah, there was a plan, and we have the receipts. Some of them are in the book.
So do you maintain I get so discouraged when I think about this time. I don't like thinking about it. And now you've added a new wrinkle to it, which is that there's this infrastructure in place that I was kind of hoping had been defanged at least. But you're saying it's still there.
They're both there. There is an infrastructure there, which is really why I wrote the book, so you can see it. However, I'm actually kind of optimistic because I really think the American people are special. Our Constitution is superlative and special and extraordinary, and we have these rights on paper, so it really is up to us to enforce them. We have to start teaching the Constitution. When I was arrested for J6, you wouldn't know this, But what was used as evidence against J6ers was if they had a pocket constitution on their person. There were a lot of people that were there that were deep believers in the Constitution. They were carrying pocket constitutions. That was later submitted in evidence against them. 50 years ago, children would memorize the Constitution, and that would be something that they learned in government schools. So we can get back to that, right? We can get back to teaching the Constitution, honoring the Constitution, bringing it back to the family, the rights to the parents, not to the government. So I'm actually kind of optimistic about American ingenuity and American family structure. So I hear your pessimism, but I think we have reason to be optimistic, cautiously optimistic.
I'm a biased towards optimism. I have an optimistic bias, but I'm so beaten down by this topic, and then thinking about what happened to you and thinking about the massive out of control infrastructure. It's really kind of astonishing that this happens to us, both our profession and to this government. Now, one of the things that happened to me during the course of all this is I became a free speech absolutist, because we must all defend that right. That's the fundamental right that's going to keep us from going all the way into some God knows what. But there are people who want to throw out the First Amendment. What is that all? I can't, it's bewildering to me. Do you understand what that's all about?
I've actually known that this has been the struggle for probably 20 years. The correct legal name of America's Frontline Doctors is actually the Free Speech Foundation. We are DBA as America's Frontline Doctors. It is all about free speech. It is all about silencing us. It is the entire game. It is the entire issue. The game changed when Elon Musk bought Twitter, right? So it is all about free speech, which is why I'm telling people that the free speech starts with you not allowing yourself to become censored. It is true that there's a heavy price to pay when people come after you, or even your mother-in-law comes after you for saying your opinion, but you must not self-censor. You must continue to speak. People have a right to hear what you say, but you have a right not to be silenced. We have a human need to do that. So I am pessimistic when I looked at what happened to both of my professions, law and medicine. It's shameful, but I have faith in the American people and the ordinary American, and free speech is the name of the game. It's everything. I
like that. That does make me feel better. But when being a physician for 4 decades, I early on we thought what we were doing was so important, and to see our peers send people home and tell them just come back when you're blue, that to me was the most mind-blowing. My mind is blown. So it's also mind-blowing to me to think about people wanting to condemn or alter the First Amendment. Is that something that I can't believe that our peers did that. So I worry that, oh my God, could they change the First Amendment? Could somebody come in here and do that? Is that possible?
I'm going to answer you as a lawyer. It's really not possible. You need 2/3 of Congress to make a constitutional amendment. It's not going anywhere. The problem is when people don't enforce it. So I fight hard to enforce the First Amendment, and I'll give you a specific example because everyone needs to fight tyranny in their own lives. The California Medical Board attempted to take my California medical license based on free speech, literally based on free speech. They sent me a letter in late 21 saying there were public comments that I made about hydroxychloroquine and ivermectin, and I should lose my medical license. I said, I moved to Florida. I didn't even need my California license, but I took a stand, put my foot down. I said, absolutely not. And I fought them for 2 years. And then I fought them for another year on appeal, and I definitively won. And the California Medical Board has had to retreat on going after doctors' free speech. This is exactly how you keep the First Amendment alive, is you have people who say no. And I encourage people to donate to various nonprofits that touch their heart. It's not going to be done by somebody else. If you're not doing the work, then there's a nonprofit out there doing the work. America's Frontline Doctors happens to be one of them doing the work in the free speech for physicians. It's one of our linchpin issues. We fight for doctors whose licenses are being threatened over speech. And so that's how you win. It's the hard work, the grinding at it. It took me 3 years, but we made a precedent in California that is going to make it incredibly difficult for them to do this again. I hope that encourages you.
It does encourage me. And I'm just thinking back to first of all, I'm just Greg Lukianoff. What's the Greg Lukianoff's organization called? Caleb, help me with that. Fire. It's called Fire. They're assessing free speech on campuses.
Fire.org.
Fire.org, exactly. But it's interesting. You're reminding me that back in 1983, I started doing radio because I thought it was important to talk to young people about this thing we were just starting to call AIDS. We did not yet have a causative agent, but we were getting into focus how it was being transmitted. And I just thought, we got to talk to people. I had this opportunity. I came out and said, we got to talk to young people about this. I was vilified by my residency director and was threatened with all kinds of things. Actually stopped for a while. And then there was a sea change where after about 6 months, the mandate become doctors must talk about this. Doctors must go out and reach out and educate young people, everybody about this. And that was, and I remember my father saying to me, they're infringing on your free speech. This is a civil rights problem here. And I was like, yeah, but I could still lose my job. I'm an intern, I'm a first year resident and stuff. And so it is just, this has been going on for a little while, I guess. And we have to, thank God I did keep going.
There's a few things. So the First Amendment is strong, and you have to just fight for it when it's being infringed upon. There's also, it's illegal to do viewpoint discrimination. So we're, AFLDS, the frontline doctors, has just submitted an amicus brief on viewpoint discrimination because the state of Colorado has blocked counselors from explaining biological truth to children with gender questions. They've actually said you can't talk about biological truth. You can talk about the dysphoria, but you cannot talk about biological truth. I think they're slam dunk going to lose that. That's going up to the Supreme Court in a few months. So that's Chili's versus Salazar. I don't see there being any way, but you need strong advocates to fight these fights. So we're going to hang on to our First Amendment, and there's people like me who are super passionate about it. So I just encourage everybody to join the fight if you can't fight yourself.
It seems daunting if you're not, when you're not, you don't understand the legal system, you're not a lawyer, it looks expensive, it looks time consuming, it looks overwhelming. I'm so grateful you're doing this, but and my son is a lawyer, and he pointed out the same thing. He goes, yeah, the courts are this is something the courts can do. This is the courts are good for something, and this could be it. The other thing is be aware of what mass hysteria is, what a mass formation is. Interestingly, I used to bring this up during the mass formation, was that Alexis de Tocqueville, who came here in 1820, pointed out, he's a Frenchman who came allegedly to look at our penitentiary system, but ended up talking about democracy in America. And one of the things he pointed out was that we had the most significant privilege of free speech prescribed by the law, but in practice, it wasn't so free. And he called it the effect of the town square. And now with social media being the town square, I mean, it's that much more breathtaking that Elon Musk came in and freed the town square, which is the one major impediment on our prescribed rights.
I think an easy fix, and I don't know if it'll happen in the next 4 years, I think there needs to be a virtual Bill of Rights, that your Bill of Rights continues into the online space. I think it's kind of a quick way to make sure that we don't lose our free speech rights ever again, no matter who runs the social media companies, right? Why should our Bill of Rights...
And then I hear you, but what do we do with the EU, who seems intent upon restricting that privilege?
The answer is financial pressure. So everybody eventually comes around to the side that can pay the money. So when we live happier, healthier, wealthier, better lives, they will fold.
Simone, I am so glad you're doing this work, and I'm so glad you're here. It's Dr. Simone Gold, X, Telegram, Truth, Getter, the Gold Report on Substack. Anywhere else you'd like people to go? Obviously, go get the book, The Selective Persecution, and look for the movie and the documentary when it comes out, because this kind of stuff, somebody's got to do a real serious visual dive on all this, because the history needs to be documented. It's very important.
Absolutely. I hope people please pre-order. It's a fascinating book. It's a page turner, Selective Persecution, on Amazon. And it was a pleasure to be here and chat with you, Dr. Drew.
When is it out? When does it come out?
It's out in May. But everybody pre-order that. It really helps. I'd love to come back.
Pre-order it now, but I'm ruminating on maybe getting you back in here once people respond to it and give them a chance to react to what you put down. So, okay, Dr. Gold, thank you so much for being here. We'll hopefully talk to you again soon.
Thank you so much, sir.
You got it. Coming up, we are going to talk to a congressman, U.S. congressman from Virginia, chairman of the House Energy and Commerce Subcommittee on Oversight and Investigations. And he has been looking at the federal excesses the COVID-19 response. We're going to keep this topic going. I'll look over on the Rumble Rants and the Restream in a second. We'll be right back after this.
It's Christmas.
If there was ever a time to be rationally ready, it is now. I urge you to consider getting one of the emergency kits from the Wellness Company, because TWC has 7 different kits that are customized for a variety of situations. Wouldn't be a bad idea to take a look at each, considering, say, what we've just been through in California with the fires. I was happy to have the field kit on hand, and the Contagion kit in particular is suited for what is being predicted to be the next outbreak. That would be the H1N5 or avian or bird flu. Of course, the same experts from the COVID era are freaking out about this potential pandemic. But don't panic. Just arm yourself with the meds you might need if this comes to pass. Contagion Emergency Kit contains ivermectin, hydroxychloroquine, azithromycin, Tamiflu, and budesonide, an inhaler that is good for airway reactivity and tightness, as well as reducing viral replication in the airways. Go to drdrew.com/TWC for 10% off your purchase.
Ask Dr. Drew.
I have no idea who Dr. Drew is.
He's been watching a lot of Dr. Drew lately.
Dr. Drew.
Did you know scammers can steal your home right out from under you? Yep, that is correct. The FBI calls it house stealing, and it's a growing real estate scam targeting American homeowners. Criminals forge your signature on one document, use a fake notary stamp, pay a small fee, file it with your local recorder's office, and just like that, home title has been transferred out of your name. Then they can take out loans using your equity as collateral, even sell the property behind your back, and you won't even know it's happening until you start getting collection or foreclosure notices. Let me ask you, when was the last time you checked your home title? If you're like most people, the answer is never, or right just when you bought the home, and that's exactly what scammers are counting on. And that is why you should look into Home Title Lock. Their $1 million triple lock protection helps keeps your home and equity safe. Here's what you get: immediate 24/7 monitoring of your property, urgent alerts if there's any charges and fraud should this happen to their U.S.-based. And their U.S.-based restoration team will spend up to $1 million to fix the fraud and restore your title at no additional cost. And here is the best up. Home Title Lock is going to give you a free title history report, and we've teamed up with them to get it so you can find out if you're already a victim and access to your personal title expert. That all is a $250 value just for signing up. Go to HometitleLock.com and use the promo code DREW250, or click on the link in the description. That is Home Title Lock, one word, HometitleLock.com, promo code DREW250 to get the protection and the peace of mind that you deserve. As I said, next up we have a congressman from Virginia. I want to get right to this. I believe he's been standing by. Let me give you particulars where you can find Congressman Morgan Griffith. He is on X at Morgan Griffith. Rep M. Griffith. Beg your pardon. It is REP M. Griffith, Griffith. And also you can find him at morgangriffith.house.gov. Congressman, thank you for joining us.
Great to be with you.
So I'm anxious to hear what you've uncovered. What did you discover? Have you heard the conversation I just had with Dr. Simone Gold? But I'm just so bewildered by so many of the excesses. It's probably my own denial that's fueling that. But there are so many things, and I know a lot about what happened, and it's still bewildering to me.
Well, it's bewildering to all of us, and there's just so many different things. And so we put in a number of bills. But when you look at all the things that the NIH was supposed to do through NIAID, that would be Dr. Fauci's agency, National Infectious Disease, Allergies and Infectious Disease Department under Francis Collins at the time at the NIH. They were doing all this research, spending millions of dollars with EcoHealth Alliance. 800,000 of that, according to their own data, went to the Wuhan Institute of Virology. And we didn't get the documents we paid for. It's that simple. We didn't get the information we paid for. And isn't it interesting that one of the reports we didn't get was from September of 2019? And eventually, EcoHealth would provide us with some of the data, or their report at least. They didn't have the Chinese data, but they gave us their report. But they had doctored some of it, as it turned out. Now, that was the evidence that I believe came out in committee. We had 2 different transcribed interviews with them. We had transcribed interviews with Dr. Fauci, but EcoHealth Alliance was not straightforward with the NIH. But NIH knew they weren't getting the documents they were supposed to get, knew or should have known which is where some of these bills come from. I mean, Chip Roy and I are carrying a bill to break up NIAID into 3 component parts: infectious diseases, allergies, and immunological diseases, because they're different. And sometimes they overlap. I'm not going to say they don't occasionally overlap, but there's also a lot of differences.
Very different.
Yeah.
It's very, very different. Different
Certainly
disciplines that supervise it.
infectious diseases and allergies are totally different. You can make some arguments on
different.
autoimmune.
They all the immune system is involved with that, but it's also involved in, we can pick a bunch of other things too. Why don't you just add dermatology to their list of different disorders that they follow? I mean, it might as well. Because I mean, the immune system very active in the derm system, so we better put that in there. But so what if you were to sort of, what do you surmise? What's your sort of theory about, or hypothesis? We won't even call it a theory. How do you pull it all together? What do you think happened here, and where did both what happened and what went off the rail?
First off, I think that both Dr. Francis Collins and Dr. Fauci were pushing the envelope on gain of function. Now, I will tell you that my good friend, Senator Paul, and Fauci got into a lot of fights. And sometimes I thought they were talking past each other, because you can have your standard gain of function, which is breeding, a Labrador retriever with a poodle and coming up with a Labradoodle. That's technically gain of function. And yet, what we really are concerned about is gain of function where there's a risk to human health. And I don't think they pay close enough attention to the grants they gave to EcoHealth Alliance, both in the beginning.
But let me stop you. I want to stop you. I want to stop each step of the way. What would be the motivation if we were to be charitable? Why would we want to support that and be charitable? Be as charitable as you can. Do we have to prepare for some attack that would help us prepare for? Do we have to develop techniques so we stay ahead of the way guys next door, just the way we would with weapons and things? Is that a mindset? What's going on there?
The mindset is that they fear that there will be a natural mutation. They fear that desperately. And so they want to be in advance of the natural mutation. So they start studying these infectious diseases. And then somewhere along the way.
It's not biowarfare. It's not biowarfare they're worried about.
No.
They're worried about just,
That's correct. They're worried about Ebola. They're worried about Mpox. They're worried about all these other things. And I think what happened, being generous, is they were worried about that. So they kind of looked the other way when they knew that they were doing research in a level 2 lab, and it clearly should have been a level 3 lab. And they kind of looked the other way, thinking, well, we got to get this research done, so we'll give it to this third-party group, EcoHealth Alliance, and they'll go to a foreign country, and, we can wash our hands of it. And that's what they tried to do. And when they realized it might blow back on them, I think there was some feeling that, if it was a lab leak even, which is what I believe happened, they were afraid it would come back on them. Well, I think it has. I think most rational people today would admit that it is the odds-on favorite that it was a lab leak. In fact, I'm so convinced of it that if there were to be a jury trial,
we froze. There you go. Is he back? He was going to. This is the 3-letter agencies that Dr. Gold was referring to. Okay, we got you back. Wow, I thought the NSA was getting involved here. I didn't want to hear what the jury trial would yield. But go ahead.
Well, what I was going to say is, I believe that I could get a jury to find on circumstantial evidence that all we have today, that there was evidence beyond a reasonable doubt, or at least eliminating all reasonable doubt that it came out of the lab. I don't think it was intentional. I think it was just sloppy work. Their filtration system was horrible. Even with a level 2 lab, I'm not sure they really met level 2, but the Chinese claimed they did. But one of their own doctors was advocating in 2019 that they might want to get a better filtration system, because basically all they had was your basic, charcoal filters. They didn't have HEPA filters.
Which
they didn't have any other kind of filtration.
They ultimately sort of immediately put that in, did they not?
In my opinion, they closed the barn door after the horses were out. And I think that's what happened. I think
exactly right.
But they were doing dangerous research, and we've seen signs they might be continuing to try to do some of that, and we've been trying to put a stop to that. And some of the legislation that we have, one of the bills that Dr. Paul and I have together is a bill that would say you got to have an independent group, independent of NIH. They have an internal group that's supposed to be looking at risky research. Nope. You didn't do a good job on COVID, whether it came out of a lab or it was somehow natural, which there's no evidence that it was natural. But even if you wanted to buy that, shouldn't be doing that research, that risky research, without an independent review process, because it raises all kinds of questions about whether or not you made the right call. And mistakes can happen, but we need to have an extra safety net to try to stop as many damages as we can and as many mistakes as we can at various labs. If the taxpayers are paying for it, we better have some security around it.
And were you looking also at the COVID response itself, the excesses of the lockdowns? And Francis Collins is on the record saying we didn't we just wanted one thing, to stop this virus. Well, that's how you harm people. I always tell people when I was training residents, I'd ask them to justify the decisions they made, show me the literature, what's your backup plan. But if they said to me, I had to do something, I would crucify. That is unacceptable when it comes to medical care of anybody, let alone the entire country, let alone the entire world. No risk-reward considerations. You are going to harm people. I don't care how much you accomplish, you'll always harm. And the harm in this case clearly outweighed the response.
Yeah, I think that's accurate. I think you can make an argument, and look, Congress is equally guilty on this. You can make an argument maybe for the first 2 or 3 months with shutting down some stuff. After the first 2 to 3 months, there's no argument for having our society shut down. I mean, my favorite one was I'm a swimmer. I've been a swimmer my whole life. We shut down all the swimming pools because they didn't think it was safe to have people swimming in a vat of chlorine. I mean, if you wanted to raise the chlorine level attached, that's fine. But it was not, oh my gosh, you can't be in a swimming pool. Come on, people. They didn't use any reason.
Yeah,
I mean, it's just a terrible.
We're allowed to go in the ocean.
Yeah, we had a guy here picked up by the Coast Guard for paddleboarding out off a pier, 300 yards out in the ocean by himself. He had to go to jail.
Because he didn't wear a mask. I'm just teasing.
No, the beaches are closed, and he didn't wear a mask. So it's so crazy. I cringe when I think about it. It's just so disgusting what happened.
Well, we damaged our children by far. We damaged our economy. And we damaged
100%.
Our children.
I said it from the beginning. I said 8 to 12-year-olds, you're going to destroy them. That's a group that is not going to recover from this. It's just so predictable. And I don't know if you saw, Gavin Newsom has a new podcast, and he had Charlie Kirk in there, and Kirk goes, "Hey, why me? It seems it's interesting. You're going to let me in on your podcast." And Governor Newsom here in California goes, "Well, my son's a great fan of yours." And Charlie says, "Why isn't your son here?" He goes, "Well, he has school. He can't miss school." And he goes, "Really? Oh, so you wouldn't let your son miss a few hours of school?" "Absolutely not. Why'd you close us down for 2 years, damage all those kids that you didn't care about while your kids went to private school? Give me a break." Oh my God. Anyway, So, these are the people leading us. Fantastic. We should make him president. And the totalitarian instinct, let's hope not indeed. The totalitarian instinct that sort of bore out during COVID was just so astonishing to me. The sort of willingness to trample on civil liberties, just boom, like that, no problem, done. Are these people, as you sort of share the findings of the committee with your peers, is anybody contrite? Are they reconsidering their positions? Are they thinking about what they did? I'll get it better next time. Or is there any self-evaluation going on in the people that lead this country?
A little bit. We've seen a little bit at the NIH with some of their scientists that they're now sounding the same kind of concerns that were raised by this. So I think there's a little bit. I don't think it's sufficient, which is why I think we need to get legislation passed that as I said, we break up NIAID, we make transparency at NIH more available for people getting royalties on certain types of research, and whether or not that's right. There may be an argument for it. To get the top scientists, you may need to pay a little bit of a royalty. At the same time, we need the information delivered to Congress so that we can make a decision on behalf of the American people, whether that makes sense or it's just somebody lining their pockets. And then last but not least, that risky research panel that I mentioned is absolutely essential, I believe, because someday, someplace, sometime, maybe not 2024, 2025 or 2026,
Of course.
but by 2029, people will have forgotten, and NIH may go back to not paying as close attention to risky research as I hope they are today. And we need an independent board out there that will make sure that we are studying all of this information and making sure that if we're doing something, there better be a good reason for it. As you said, it can't just be, well, we got to do something. No.
Yeah, can't.
We need to leave some of these viruses alone. They're very dangerous. Why would we want to spread them around the world to do research and possibly have an outbreak of, and the one that I'm most worried about in the midterm is monkeypox. I mean, bird flu is something to keep an eye on, but there's a lot of things we can do on bird flu. But monkeypox is a problem. Ebola, it's a problem. Well, why would we want to go and stir everything up and spread those viruses around the world with, hundreds of researchers or even dozens of researchers working with the virus? Every time you have that virus out there, there's a greater likelihood that it's going to be some kind of an accident or somebody's going to forget they've got it in the back of the freezer. And I mention that because when I first got to Congress a number of years ago, they just finished a study of U.S. labs, and it was a government lab. They found a frozen substance in the back of one of the lab freezers. Nobody knew what it was, so they took it out and they tested it. Had live smallpox living in, it was frozen, but it was in the back of the freezer and it was unlabeled. So the more times you put human involved, and there was no outbreak as a result, the more time you have that kind of human involvement where they're taking it in and out of the freezers or refrigerators, they're messing with it in the lab, they're goofing around, doing whatever. I mean, people do things.
Yeah.
And next thing you know, something bad is breaking out on the world that we don't have any information on. And that's what happened. One of those scenarios is what I think happened with COVID-19.
To go back to the NIH and supervision, one of the most poetic Shakespearean chapters of the COVID saga is the fact when Jay Bhattacharya told me that he was being considered for NIH, I took my breath away. I'm like, oh my God, this is the greatest news I've ever had. Shakespeare could not write a better drama than what happened to him. And so I'm so grateful for that. And I have deep and profound respect and faith in what he will do. So I think you can rely on him to pay attention. Whether or not he can set up a system that will continue to do so, I have faith he might. My other question was that I'm wondering what your colleague, Dr. Ron Paul, is thinking as it pertains to something that I'm about to sort of frame. You talked about how they want to go after monkeypox and bird flu, blah, 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 blah. It all feels fundamentally like a hysteria and like an absolute denial of the biological reality of the human experience. And forget human, mammalian experience. I mean, they're focused on these nasty viruses. In the meantime, there's polydrug-resistant tuberculosis in my town. There's also indigenous mosquito-transmitted dengue fever, which is a major, major deal in my town. And no concern, but we're going to go after those viruses, destroy the world. No, look, shit is going to happen in a biological system. It's just the nature of the system. You're not going to be able to stop it all. It's just not so. And so there's this, it feels like a weird denial of that and a hysteria, denial of biological reality and a hysteria as it pertains to the boogeyman. And by the way, there was pandemic preparedness for the boogeyman and they threw it all away when the pandemic actually occurred. So how are we supposed to rely that they're going to do the right thing next time?
Yeah, I agree with you that there's some denial. They're looking at these significant threats, but ones that are more remote instead of looking at the immediate threat. That's the denial. The hysteria is, I think, and this is an opinion based on some information, but it's just part of my gut feeling. I think that the leaders at the NIH thought they could get ahead of this, and they were so good, they could prevent future outbreaks of bad things like Ebola mpox and
No,
coronaviruses.
something will happen. Not that I want them to give up, but something will happen. Something will happen. Let's prepare for that.
And they didn't look sufficiently at the risks they were taking, and they weren't focused on, and I think this is true across a lot of government agencies, they weren't focused on the day-to-day stuff that's a real problem. I mean,
Yeah.
you're right.
Yeah.
The antibiotic-resistant bacteria out there is a big deal. I've been pushing for phage therapy. I love the concept because we're going to need it. And I'm probably one of the few people that's actually visited sewage treatment plants for a different reason, but that's where you find the viruses that attack the antibiotic-resistant bacteria. Great book out of a couple, The Perfect Predator, coming out of San Diego State, and how they saved that man's life. It's a fun book to read. Lots of good science in it. It's about 5 or 6 years old now, talking about phage therapy. But those are the kinds of things we need to be looking at, because that's a worldwide problem. And it's here today. It's not here next month. It's not here 5 years from now. It's here today. And then the dengue fever, it's a problem.
And in the meantime, by the way, while you're putting your fingers in the dike, if a virus could travel in on an asteroid or something. Something could come. Who knows what? We can't predict it all. We can't get rid of it all. We just can't. It's not in our biology.
I can't help but laugh a little bit at that, because when I was in high school, I read a Scientific American article that posited that perhaps the common cold came in on an asteroid because it didn't exist until something like the 12th century. It was not in the medical records anywhere, and then all of a sudden it's all over the place. And so we say that, but we have seen microbial life in several different places in the space, and it's a little out there, but it's possible.
People. This makes me angry a little bit, because people. They talk about the trillions and trillions of planets and go, well, there's got to be life somewhere. Yeah, but maybe not mammalian life. The most likely thing would be a virus or a bacterium. That's by far the most likely thing, and ones we have not seen before. And it will show up here on a comet or something, and then we'll have a problem. And that's that. That's just. And by the way, I'm of the opinion that some of the speciation and leaps forward in evolution may have come from things like that got intercalated. I mean, where did mitochondria come from? Those are little bacteria that created the mammalian cell. That's what they are. Where did those mitochondria come from? There was plants. All of a sudden there was animal cells, and the mitochondria is what did it. So I don't know. Maybe that came in on a something.
Maybe. I believe that that's God playing with us, and that He does these things, and He uses different devices. But I think it's God's humor.
I'm good with because it is such an overwhelmingly massive consideration. I call it what you will. I mean, frame it as you will. But it's bigger than us. Way bigger than us.
Yes, sir.
And so there you go. So back, if you don't mind, to the pandemic preparedness. Why do you think that was tossed out with such vigor? It was completely just crushed. And a new playbook was invented with things like social distancing and 6 feet and all this nonsense. And then the world adopted it. This is the part I can't believe. The world took it on. How do you have a sense of how that happened?
I don't. I mean, my gut again is that they panicked, and I think there was some feeling that in the back of their minds they would deny this. They have denied it. That they thought maybe it was a lab leak. Even those who most staunchly said it was not a lab leak, I think deep in the recesses of their brain, they woke up at night going, "Oh my gosh, we might have accidentally contributed to this." And I think that led to them going to more severe restrictions, because they were trying to put the genie back in the bottle. That's, again, conjecture on my part. And as I said, the scientists who were involved at the time would all deny that. But I've got to believe that's part of the explanation for such a, and lasting more than 2 or 3 months, such a strong, we have to continue to shut everything down response.
Yeah, it was weird. It was so weird. What if we were charitable about this? Again, I'm trying to soften the the blow of all this as a way of sort of peeking under the hood. Being charitable, what if they were not having secret thoughts about a lab leak? What if their secret concern was, oh my gosh, I've heard about these bioweapons, and these bioweapons have mutation capabilities that are built into them that could, amplify their infectivity with time or something. Do you think that was a possibility in some of these folks' minds?
I have to say, I have not seen any evidence in my examination of witnesses and talking with people of any thoughts about bioweapons in this case. Now, and a lot of people early conjectured that maybe it was something the Chinese planned. If the Chinese were going to plan that, which I don't think they did, they would have had it affect non-Han Chinese, people. It would have been specific to other races, not them, and they suffered just as badly as the rest of the world. So I think this was, I truly believe, in my opinion, and I've stated this to Collins, I think to Fauci too. I think what happened was we gave them the humanized mice, which they didn't have. The Chinese didn't have that. We gave it to them as a part of this coronavirus work. And they had the ability to do a lot of mixing and matching. And, I know that this is not part of the Chinese culture, but I can see some of my buddies, if they had the capability of doing something, saying, hey, let's look at this. Let's see what happens if we do this in the lab. And then they accidentally created something and they couldn't figure out how to get it under control. That I think is your best theory. Bioweapons are a concern, but I think you would see something that was targeted more to the enemies of China if it was a Chinese plot, or to some other nation if it had come out of their nation. You would have seen something that triggered, and there's lots of diseases, that affect, Africans and Greeks, sickle cell,
So
Celtic.
let it be noted that Representative Griffith is a racist. He dares to say that certain viruses attack certain races. Of course, there is different genetics and there's different. Of course, there is. I have to select. I have to be careful with antihypertensive I select for different racial groups because they respond differently. Of course, the alcoholism, it affects certain groups. It's just the way the human is. There are different genetic groups, as you said. The sort of classic thing is sickle cell, but there's a million other ones. There's a million other ones, and it gets more and more complicated and granular as you look into the biology of the human.
It does, and there's no question about it. I mean, I have blue eyes. There's a study out there that says you can trace that all the way back to one mutation somewhere in the Nordic countries tens of thousands of years ago.
Yeah,
so
we can. What you can argue, you can argue about whether race exists. That's a reasonable argument, but you cannot deny the fact that different groupings of people that evolve in different environments have different biological responses to certain pharmacological agents and infectious agents. It's just the way it is. And if we don't know that as physicians, it's going to be a big problem. It's going to be a big problem for the people we try to treat because we're going to treat them incorrectly. Oof.
That's true.
Makes me so angry. All this stuff.
Happens, yeah.
All right. So, well, listen, I want to let you go. Is there anything else that you have learned that you'd like to share with us, or things that are in your crosshairs going forward?
I'll just always be keeping an open mind. And if you've got some good studies, I always like to read a good study. Sometimes it takes a while because I have to look up a lot of the words if it's not in my field, which some of this is and some of it isn't. But I enjoy learning. And so that's what we have to keep doing, is pushing forward, getting the information, getting the facts, and make good decisions based on actual facts and real science.
I think it would be worth all of our while too. I don't know if you heard my last guest, but that intersection of the law and medicine, Simone Gold's book, I think is going to be a historical document in terms of chronicling where that went off the rail as well, as well as the practice of medicine.
I look forward to. I've heard her speak. I've met with her before, and I look forward to reading her book.
Congressman, thank you for being here. Thank you for your work. If anything, I hope you'll raise your hand and let us call upon you if you have anything sort of new or interesting that comes across your desk or your committee. And we look forward to just get to the truth, and let's reduce the probability that anything like this happens again.
And that's the key. That's the key. Reduce the possibility of this happening.
Thank you so much, sir.
Thank you. Have a good evening.
We'll give you his particulars again. That is Representative Morgan Griffith. You can get him morgangriffith.house.gov, and also Rep. M. Griffith on X. Susan, are you leaning into? I don't think your mic's on. There you are.
I don't know why it's not
I think it's working
today.
now. Yep.
So what was the name of that virologist that we interviewed that said that she thought it was a lab leak?
I was going to bring her up, but I decided.
I know, you don't want to call him out. But, I mean, it could be what he thinks, but I don't know. It
Shoot,
just seems
help!
like-
I was going to bring her name up, and I was thinking of her and her name 3 minutes ago, and now
Ling,
it's
Caleb, you must remember.
Yan.
Li Ming Yan?
Li Minyan, yes.
Yeah,
Li
see, I
Minyan.
knew he could do it.
Thank you, Caleb.
Li Minyan.
Look what a young brain can do. Li Minyan. But she had what I liked about her story, she worked on the backbone for the People's Liberation Army, and she has a theory about what she was doing, and so, I
Thinks the CCP was behind it.
she thinks she thinks there were 2 releases and they were both intentional. I don't. I actually don't. It doesn't.
Well,
make
I always
common
wondered why
sense
we
to me.
weren't mad at them and why we weren't. But then people said because we were behind the gain of functioning, Fauci was involved, so we didn't call them out.
I think the times call for us all to not be hysterical, or we will be as bad as the people who were hysterical during the pandemic.
But did she say it was a planned leak or it was an accidental
She said it was an
leak?
intentional leak. And this is the New York Times, right? This is this last weekend.
My new favorite.
And
my new favorite headline.
Yeah, but there's a couple of things about it. Leave it up there. So, first of all, it was an op-ed. Secondly, it was by a sociologist. And thirdly, New York Times is already distancing themselves from it. And that's what's making me angry. The New York Times should be leaning into this and get some reporting. They're supposed to have reporters about, giving the facts and evaluating the facts.
But they're all too biased.
Well, they indeed are. So I don't know.
The most interesting part
Well,
about
here-
that article, the New York Times one, that we were badly misled about the event that changed our lives article, are reading
Yes.
the comments from people and seeing some people, this is a moment that made them click and like, hold on a second. We
Oh, really?
trusted all these. Yeah. Oh yeah. A lot of the comments are like that. A lot of them are still very, very deep in that lost
Denial.
state of they try to find ways around it, and they're criticizing the New York Times for it and saying it's going to be misused by right
I didn't
wingers.
actually
And I'm
read
like,
the
but look
article.
at facts. Just
Did
it
she
doesn't-
review the zoonotic origin evidence? Because there is evidence. It's not like it's a wild
Oh, yeah.
theory that came from nowhere. She
think
reviewed
it
that
was-
also, right?
It was more so about how they just completely discounted any idea that wasn't
Right.
fitting with
That's
that
right.
narrative.
That-
And then it's so interesting. Like, to me, it was so interesting because I absolutely read that paper and the proximal origins paper, whichever one that first really started it. And I don't know who any of those doctors and researchers and names are, but I saw a list of a lot of names and I just thought, well, they must be right. It's the same thing to me about those 50-something intelligence agents that said the Hunter Biden laptop wasn't real. I immediately discounted it. And I feel like that's a spinoff of Gelman amnesia in a way, where I yet again allowed myself to be misled because there were so many names. And then it comes out all of them were lying to me.
No, they weren't lying. They were not lying.
Misleading.
Christian Anderson was one of the. No, they believed it. And when you hear him and what he wrote and talked about the experience of presenting his theory to Dr. Fauci, he is very clear that his opinion is that Fauci did not urge him one way or the other. He just listened to him present his case. And his case, and were 2 or 3 of his colleagues, was they were looking at the viral structure and sort of saying, hey, this could happen this way. Not that it did happen that way, that it could happen that way. And we're still in that state. Everyone needs to keep their mind open about everything when it comes to biology.
That's absolutely someone I
say,
would
thus
love.
saith the Lord, you're going to be, when you say thus saith the Lord, you're going to be in a problem. Science, let me just restate, scientific method, Brett Weinstein, God bless you for supporting me on this, is a very delicate mechanism. And the best it can do is take a hypothesis, confirm it repeatedly through experimentation, which then, after repeated experimentation, brings it up to the status of theory. That's it. And if you're lucky, that theory can create some laws that are mathematical. If the theory really is predicting something in the future that you can then model mathematically, not even model, predict with a mathematical formula like gravity or the Schrodinger equation, things like that. And even the original theories on gravity, the original predictive structured, the predictive formulas, Isaac Newton, turned out to be incomplete, inaccurate. There was a more accurate way of saying it. And then Einstein came up with a more accurate theory and a more accurate model's the wrong word, formula for predicting the future. And so these are provisionally laws, and laws are above theory, but everything in biology is pretty much theory.
I would be very interested in speaking with Dr. Christian Andersen specifically, because from the very earliest documentation about the pandemic, his name is always popping up. And he did seem like he was very straightforward of a researcher. It didn't seem like he was spinning things. If I remember correctly, it seemed like he was trying to stick with facts.
Yeah. Yeah, no, he was not. That's why I pushed back on you calling it lies. I mean, there may have been lies amongst it, but it was not him. It was not that original group. What's weird is it was a letter. It was a letter. It was rushed out. It wasn't a paper. It was a lot of weird aspects to it. But okay, they needed to get some
clarify
that. There.
I wasn't thinking the proximal origins paper was lies. I was saying that the intelligence agents that said that the Hunter Biden laptop and was all Russian disinformation. I was saying that some of those people were obviously misleading us for political purposes.
Well, what I have learned through this, what Dr. Kelly, who's joining us on Thursday, by the way, at noontime, what Dr. Kelly calls the COVID debacle, what I have learned from that is whenever when there's an active suppression of reasonable alternative opinions, in fact, any opinions, something's up. There's something wrong. That when somebody says, "Hey, I disagree with Christian Andersen. I think it might have been a lab leak," and that has to get suppressed from all fronts. Oh, watch out, everybody!
Red flags.
Not only are you red flags in terms of it being a psyop, and then the people that are doing it that are not part of the psyop, that is a totalitarian instinct. Telling other people what they should believe and what they should say, disgusting. We should all be disgusted by it.
I still disagree with him.
Is your mic on? Is her mic on? Okay.
No, I can't hear
Go
you.
ahead, disagree with.
I still disagree.
Oh, we can't hear you.
God damn it.
There you are. There you
Hello?
are.
Is this thing on? Okay. So I still disagree because if it was a couple of knuckleheads from the United States with the union mice and they let it leak by accident, it would be all over the news. It wouldn't because they made it up. They made up this story about the pangolin. It makes me suspect China even more.
Look at the list here. Kelly Victory noon on Thursday. And then we're going to try to switch to 2 o'clock because so many other shows are on at 3. So we're going to be at 2. Ramyo Gendra and Sabine Hazan in here. Be very interesting. Salty Cracker coming back. What's that, Susan? Oh, yeah. I'll do that in a second. But I want to talk about our friends at Paleo Valley in just a second before we wrap up. But that is there's a lot more coming. I'm really looking forward to that 26 show. Tom Renz has got some updates for us as well. And we have some updates about our friends at Paleo Valley. We'll talk about that very quickly. Of course, I just had bone broth before the show. It really helped me with my hunger. And of course, we just had a grandchild born. It reminds me that during our days, Susan, sleepless nights, brain fog, when our triplets were infants, Paleo Valley's protein products at the time could have been very helpful. I was living on Dove bars, if you remember that at the time. This is much, much, much better nutrition. Much. The processed meat sticks, like the venison, chicken, beef, the venison and beef are grass-fed. The chicken is pasture-raised. The company uses a unique method of fermentation that is chemical-free. Again, they're exquisitely careful with everything they provide. Susan and I also would love the chocolate and the salted caramel grass-fed bone broth. And as we mentioned our bottomless coffee, which is 3 pots a day, something like that. we put Paleo Valley into it. Paleo Valley's bone broth protein powder is made from bones, not hides. And of course, not only us, but my son and daughter-in-law swear by it as well. It is delicious. It is a great source of protein. It's collagen. And we can't give this the little one just yet. Go to drdrew.com/Paleo Valley for 15% off your first order, 20% off when you subscribe, which we highly recommend. Again, collagen, high quality protein. And
it tastes good too.
It does taste good. It's very hard to get bone broth to taste good. And Autumn and the group has done a great job with that.
The sticks are not salty.
They are not indeed. They're low. All this is low calorie, not like a Dove bar. Okay, Caleb, anything else I should run through? I'm looking at the rants and the restream.
Go buy it.
Thank you, Dee Dee. Dr. Li Wei Lang and the PPE hoarding months before the outbreak. That's true. She had lots of interesting theory about that. We should maybe bring Li Meng Yang back in. She was always very interesting, and her English has got a little clearer.
Emily, can we get her tomorrow? That'd be so cool.
Early, like about 11 o'clock Eastern. So, that's what I'm saying. If we did it, we'd have to. So we could do it early tomorrow if somebody wanted to do one early. Okay. Okay, with Kelly. Kelly is being a little proprietary. She wants to spend some time with me. We had a lot of catching up to do. She and I. So, but maybe Lee Man can hear. Has anyone seen comments about the Contact Dr. Drew form not working? Oh, have issues with online order. Thank you, Dogma. Susan, there's something.
I'll check on that. That's really that's strange because we've gotten emails. So that might. I'll check on it. I'll double check.
The form's not working. Have issue with online order.
Are
online
you talking
order.
about the bobbleheads?
Maybe.
DrDrew.com/shop.
Shop. And the shop, by the way.
Bobblehead. Let me show you what
And back to the store again. We've got a lot of great stuff available on the store. If people are interested in it. Is there a drop down for the store now on the homepage, Caleb?
No, it's that. I'll check on that because the contact form at drdrew.com is different from any of the others from the shop and things like that.
No, but I switched topics on you. The store is slowly opening here, and we've got some really interesting things there to empower patients. This is drdrew.com/store. Shop.
Get a bobblehead.
The last I was told is that I wasn't supposed to promote it yet. So they're geting a sneak preview by hearing about it now.
The store.
Yeah.
The store. No, yeah. I've been told to kind of roll it out a little bit. Oh, wait. No, Law and Order. But so the bobblehead floating over my head. So my question is, where do they click through if they want to look into it? Because I would advise people to do so now to familiarize themselves with the story, and they can send stuff at the contact form, what it is they'd like us to have there. We can make more things available. But is it just a click through now, or do we have that up yet?
It's if they want to go preview it, it's at shop.drdrew.com.
Shop/Dr. I'm gonna have to ask that 10 more times.
Shop.drdrew.com. No slash.
Shop.
Is it also /shop, drdrew.com/shop? Both?
Is that the store?
No.
Not yet.
We're gonna wrap this thing up.
I'm looking.
Right,
not yet.
It's Dog Mama had issue with the bobblehead. She was trying to get.
That's a different one. Yeah, we'll contact them.
Yeah.
It's drdrew.com/shop. That's how you get the bobbleheads. You get 12 bobbleheads for $35-ish. It's about $35. So you can sell them or you can keep them for whatever reason. And I'm going to look at it right now.
And it's store. Oh, there it is. And it's store/drdrew.com for the. /bobblehead, as you can put it on too, but store/drdrew.com for the.
No, that's no. It's shop.drdrew.com for the preview of the shop, and if you want to get the bobbleheads, that's at drdrew.com/bobblehead.
/shop. No, it's shop.
Hang on.
No.
Dude.
No.
Dude, I'm Googling it. It's
you could probably get to it from all of those, Susan, but.
Oh, shop is for the bobblehead. She just put it up on the website.
drdrew.com/shop.
That will give you the bobblehead.
And you get 12, a case of 12 for $35.99. If you want to go to the shop, let's see if that's.
Okay, hold on. We're looking at everything. Uh-oh. Okay.
Yeah, if you want to go to products that we have, all our good products, TWC and all the great products, then you go shop.drdrew.com. See, it's very confusing, and I don't know why it ended up like that, but we have to get rid of some of these bobbleheads.
Well,
this
is great radio, by the way, because we can't hear Susan.
Oh, they couldn't hear you at all, Susan. All right, we're gonna have to wrap this thing up. Let's wrap it up. I don't want to.
So
people love bad.
No, we need to sell these damn things.
What does the website say? One more time. Where did you find it?
drdrew.com/shop.
drdrew.com/shop, and you can preview the store at shop.drdrew.com. There we go.
So we're going to confuse them.
All right. Thank you, Diva Dog Mom. We have lots of dog mamas out there. All right, we'll see you guys Thursday at noon with Dr. Kelly Victory making a command performance. She will be here with us noon Thursday. See you then. Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273 888-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.